Good? Okay, good. So, my name is Ashton, and I did Bell's palsy. So, a little bit of background information on Bell's palsy. It is a paralysis or weakness of the muscles on just one side of the face. Damage of the facial nerve due to things like inflammation that controls the muscles on the one side of the face causes that side of the face to end up drooping. And the nerve damage can also affect things like the sense of taste, how you produce tears, and how saliva is produced. Some more background information. So Bell's palsy usually comes on suddenly, around somewhere in the middle of the night. It's not really clear what the cause is, but it is thought to be caused by the herpes virus. And there's absolutely no link between stroke or a transient ischemic attack and Bell's palsy. So many people who have Bell's palsy think it's because they had a stroke, and it's really not. And Bell's palsy will usually get better on its own without any sort of treatment within a few weeks up to 2 months. But there are some cases where it doesn't go away and it's permanent. So on the picture you see up there, this is just what a Bell's palsy droop looks like. So you can see that there's no muscle tone. In the cheek area, the lip is drooping, the eyelid droops as well, so they have a lot of problems with their eyes too. They can't smile, they can't pucker, can't blow out their cheeks. So my patient is Mary, and she's a 35-year-old woman. She is a high school science teacher, so she is a heavy voice user, and she's also a girls volleyball coach, and she is married with 3 children. A little bit of case history. She was recommended by her primary care physician after being diagnosed with Bell's palsy 1 week ago. So she did go to the emergency room and had to have all the other tests ruled out, such as stroke, transient ischemic attack, and different things like that. And then once those are all ruled out, they just fall onto Bell's palsy. She was in great health before the onset of Bell's palsy, but she did complain of having the flu a couple days before, which is common. People who experience this will say that they felt sick, they had the flu, they had a cold, and then all of a sudden they wake up with this. She's currently on no medication. Sometimes they do prescribe medications for Bell's palsy, but they try not to at first to see if it's going to go away on its own. She does have complaints of dry mouth since she can't completely close the lips, trouble swallowing since she has no muscle tone, and slurred speech since the incident has happened. So Mary's concerns with this Bell's palsy is she's concerned about her job since there's not really a clear idea of when this is going to go away or if it's going to go away. Some cases go away in a couple of weeks, other cases go away in 2 months, and then other cases just stay forever. So there's no guarantee as to when she can get back to her job or when she'll be able to talk normal again. She's worried about the long-term effects and if this will happen again, and sometimes it can. And then she's also worried about her facial features. She doesn't want to have a drooping face, which is, I wouldn't either, so I don't blame her, especially since she is a teacher. She's worried about her appearance, and she's also worried about being able to get in front of the class and be comfortable talking in front of them again. So during the examination, I did a facial examination, and there was drooping on the left side of the face, including the eye and the cheek, and there was an inability to fully close her mouth. I did a modified barium swallow test since she was complaining about swallowing problems. And since there is incomplete closure of the mouth, she had a lot of difficulty swallowing, and then there can also be some drooling of liquids since you can't fully close your mouth. During spontaneous speech, she did have a slurring of words because she has no muscle tone, so it's hard to use her articulators. And she had flaccid dysarthria, and this is because her lower jaw was affected as well. So it's kind of hard to say what the treatment is going to be right away because it's only been a week. So right now what you really want to do is just keep them comfortable. They talked about where you like tighten and then relax your facial muscles so that you don't get the wasting of your muscles because you still need to keep them engaged so they don't completely go away. Also massaging the facial muscles, so like the cheek, the brow, around the eyelids, and around the lips. Making sure that she eats soft foods and slowly, so there's no choking. She also needs to keep her mouth moist, drinking clear liquids, using ice chips, and be patient with speech because it's going to take her longer to communicate. So she needs to just be patient, and she can't really say very many utterances. So she just needs to take her time, be slow, tell everyone around her to be patient with her, but do encourage her to talk because we don't want her to lose any of that.